Good afternoon. I will be presenting the abstract supporting the supporter, lessons learned from a virtual peer support intervention for young pregnant women living with HIV. I'd like to acknowledge the peer support workers and the participants that made this work a success. I'd also like to thank our partner organizations that made this work a success in collaboration with Zambart. I'd like to acknowledge the funders, that is Vive Healthcare, the Medical Research Council, the Department for International Development, and the NIHR. I'll begin by giving a background, methods, results, lessons learned, and then I'll give a conclusion. So young pregnant women living with HIV, age 15 to 24 years old, are at an increased risk of mental health problems. And this is usually because they sometimes discover for the very first time that they're HIV positive at the ANC. Apart from that, they lack adherence and social support outside the clinic space. In addition, young pregnant women living with HIV are faced with a lot of community myths and misconceptions about pregnant women living with HIV. These and other problems tend to build up and mentally burden young pregnant women living with HIV, and consequently, peer-led psychosocial interventions have been recommended for young people living with HIV, including young pregnant women. So peer-led psychosocial interventions for young people living with HIV sometimes come in form of integrated services that include HIV testing as well as ART services. And these are usually offered by young people themselves or peers. And then the peers are usually formally or informally engaged in health facilities, and they sometimes run buddy programs and support groups. So Project INSACA was developed in 2008 by the SHM Foundation, and it was a response to the negative mental health impact of social isolation experienced by people living with HIV in Jalisco, Mexico. In 2018, the model was piloted in Zambia, and it was carried out amongst young pregnant women living with HIV. And the peer support workers are the ones that manage the support groups. The aim of the study was to assess the feasibility and acceptability of a mobile phone-based support group intervention in Lusaka, Zambia. And the objective was to increase psychosocial support for young pregnant and new mothers. So we hypothesized that increased psychosocial support will improve adherence as well as promote elimination of mother-to-child transmission. So beyond the INSACA pilot, INSACA was scaled up and nested in Yatu Yatu, which was a cluster randomized trial that was that started in 2020 and is coming to an end in September 2021. So this is basically how INSACA works. And the peer support workers are at the center stage of making most of what INSACA is happen. So the peer support workers are young, community-based young women, aged 24 to 30 years old, and they are trained HIV psychosocial counselors who are recruited through the ART as well as the ANC departments. So their roles in INSACA were basically to play a role in the recruitment of participants from the ANC, as well as manage the virtual support groups and do a lot of troubleshooting here and there as and when needed. So the peer support workers had their own virtual support group, and part of the data that was used to analyze this work was connected by way of that group. Apart from that, they wrote weekly reflections and attended physical debrief sessions. So all this data put together was what was thematically analyzed. So throughout the study, a two-tier approach was used to support the peer support workers physically and virtually. At level 1, we had the peer support workers support each other, as well as write reflections, personal reflections on an individual basis about their experiences and about what worked well and what didn't work so well. Apart from that, at level 2, the peer support workers were supported by a larger INSACA research team, which included guest speakers and the core INSACA team. So the peer support workers reported that they experienced anxiety, especially when it came to getting and keeping the attention of their participants virtually. Apart from that, they also experienced anxiety about handling domestic violence and other difficult situations. So these are a few quotations, these are a few quotes about how the peer support workers experienced support and what their experience was like. So we learned that giving the peer support workers autonomy to run the support groups made the peer support workers feel empowered, and this contributed to them feeling less anxious. Apart from that, giving them the opportunity to openly express themselves and discuss their personal as well as group experiences lessened their challenges, fears, and anxieties. Apart from that, the peer support workers considered writing reflections and attending debrief meetings therapeutic. So we demonstrate that providing structured support pathways empowered the peer support workers to manage complex discussion with this group of vulnerable young women, and also identifying the needs and the stages throughout the study that were critical in developing support structures was helpful in ensuring that the peer support workers' psychological well-being was taken care of. With that said, I have come to the end of my presentation. Thank you very much.